Did you know that nearly 1 in 5 adults in the US experiences mental illness each year? Yet millions struggle to access proper care. Why is mental health care so difficult to obtain? From high costs to a shortage of professionals, the system is failing those who need it most. Let's dive into the challenges and explore what can be done to improve mental health care in America. One of the biggest barriers to mental health care? Cost. Therapy sessions can range from $100 to $200 per hour, and psychiatric care can be even more expensive. Many insurance plans offer limited coverage, leaving patients to pay out of pocket. For those without insurance, getting help can feel impossible. How can we make mental health care more affordable and accessible for everyone? Even if you can afford care, finding a provider is another challenge. The US has a severe shortage of mental health professionals, especially in rural areas. Some patients wait months just to see a therapist or psychiatrist. This delay can make conditions worse. How can we encourage more professionals to enter the field and ensure timely care for those in need? Stigma is another major issue. Many people avoid seeking help because they fear judgment from family, friends, or employers. Mental health struggles are often misunderstood, leading to shame and silence. But mental health is just as important as physical health. How can we break the stigma and create a culture where seeking help is encouraged and supported? Emergency mental health care is also lacking. Many people in crisis end up in emergency rooms or even jail instead of receiving proper treatment. The 988 crisis hotline was introduced to provide immediate support, but more resources are needed. How can we build a system that responds effectively to mental health emergencies and provides real solutions? Teletherapy has emerged as a promising solution, making mental health care more accessible. Online therapy platforms connect patients with licensed professionals from the comfort of their homes. But is it enough? Some argue that virtual care lacks the personal connection of in-person therapy. What do you think? Can teletherapy bridge the gap in mental health care? Workplace mental health support is improving, but there's still a long way to go. Some companies offer employee assistance programs, EAPs, but many employees don't use them due to stigma or lack of awareness. Should employers do more to support mental health? What policies could make workplaces more mentally healthy environments? Youth mental health is in crisis. Anxiety, depression, and suicide rates among young people have risen dramatically. Schools are trying to provide more mental health resources, but many lack funding and staff. Should mental health education be a required part of school curriculums? How can we better support young people struggling with mental health issues? Medication is a key part of mental health treatment, but access is another challenge. Psychiatric medications can be expensive, and some require frequent doctor visits for refills. Many people struggle to find the right medication due to trial and error prescribing. How can we improve access to affordable, effective mental health medications? Community-based mental health programs can make a huge difference. Local organizations provide free or low-cost therapy, support groups, and crisis intervention, but many of these programs are underfunded. Should the government invest more in community mental health services? How can we support these vital resources? Legislation plays a big role in mental health care. Laws like the Mental Health Parity Act aim to ensure insurance covers mental health equally to physical health. But enforcement is inconsistent. Should the government do more to hold insurance companies accountable? What policies could improve mental health care access for all? Social media has a complicated relationship with mental health. While it can provide support and awareness, It can also contribute to anxiety, depression, and unrealistic expectations. Should platforms do more to protect users' mental health? How can we create a healthier online environment? The future of mental health care depends on innovation and policy changes. From AI-driven therapy to expanded insurance coverage, there are many possibilities. But will these changes happen fast enough? What do you think is the most important step toward improving mental health care in the US? Mental health care in the US needs urgent reform. What can we do to push for change? Share your thoughts in the comments. If you found this video informative, don't forget to like, share, and subscribe for more content on important issues. Let's keep the conversation going and work toward a better future for mental health care.